I'm going to talk to you today about pet therapy and a geriatric patient. I helped Agape Hospice set up their animal therapy program where we go into the nursing homes and we take cats and dogs and we interact with the patients about once a week. Different people go in. I do it about every 2 or 3 weeks. So there's a rotation so the animals don't get too stressed. In the U.S., according to the CDC, there's about 1.5 million patients that are in nursing home or assisted living facilities. Many of these patients, of course, had pets prior to being in the nursing homes, and many of them really, really miss being able to have pets, but most nursing homes, of course, do not allow pets, and many of the assisted living facilities, there is a pet fee that is a lot of times very prohibitive for people on a fixed income. When we take the pets in, it's not something to make up, of course. We can't replace the pets that they've either had to give away or that have passed away. But it does allow them to have this interaction that they don't get anymore without us coming in. There are many benefits to having the animals come in. Interacting with an animal lowers the cortisol levels in your blood. And cortisol is a stress hormone that causes body-wide inflammation, so it raises your blood pressure, your triglycerides, all that nasty stuff that is the last thing you really need when you're already having so many health issues. So, pets have also been noted to increase social interactivity, and I see that when I go in with my girls, because a lot of times we go into the communal room, and all of a sudden all the patients are congregating, and they're talking to each other, and they're talking to us, and they're telling stories. That also increases their activity level. They get out of bed in order to come see the cats. So they get to interact more with each other and with the animals, and it really helps make their day. It also provides a calming effect. Many of the patients with Alzheimer's, because of how they get confused, when they interact with the animal, it brings back a lot of good memories from, say, their childhood, and it relaxes them. And just petting a cat has been shown to reduce stress and reduce all the anger and things that they'll feel because they're confused and they don't know what's going on. So it's a really good experience overall. I talked to one of the activities coordinators at Ashbrook Village, which is an assisted living in Villarica, April, and she said that the patients love it when the cats come to visit. They ask over and over, when are the cats coming, because they forget that they asked for 5 minutes ago. Are they coming now? Is it today? Is it tomorrow? When are they going to get here? And then when they see them come in the door, their faces just lights up, and I'm going to show you some of that in just a minute. And when they see the cat, even cats on TV, she said, when they see cats on TV, they'll talk about, oh yeah, remember the cats came, and we got to play with the cats last week. When are they coming again? Or the dogs, or whatever it is. And for the ones that are cat lovers especially, it makes a big difference in how they feel, especially that day. I was going to give some, at first I was going to give, and I know it says in the brochure that I was going to give some statements from patients, but I thought, a picture's worth 1,000 words, and I thought I'd just show you some of their faces when they're interacting with the animals, and that would give you a better view of how these patients interact with the animals. This patient has actually lost the ability to speak. So while he couldn't, the only thing he said while I was there, and just the big grin on his face, and he said, kitty, 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 kitty. And Callie and Teresa got up there, and he was just so happy. And he couldn't tell us that I'm really happy that it's the cats. That's all he could say. And he could barely speak at all. He was getting very frustrated. But when he would pet the cat, he would calm back down. And he would just say, kitty, 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 kitty. He was so excited that they were there. This patient follows us around in her wheelchair. She actually loves the cat so much. When we go to another patient's room, she'll sit outside and wait to have more time with the cat. She loves all animals, but especially she remembers their names. She's in assisted living, so she's the ones in assisted living are a little more able to get around and have more of their facilities still, so she is so excited when they come. This patient was she was having very severe dementia issues when we first met her, but interacting with the cats, one day she just lit up and started telling us about her cat and his name and how she missed him and all this kind of stuff. It was really amazing. And she had actually since passed away. But she was able to interact with the cats in her last few months of life, and the people at Horizon Bay said it really seemed to make a difference in how she was able to interact with other people too, that it really brought her out of her shell. After her husband died, she had been really withdrawn. she has a cat of her own, and she misses it very greatly. You can't see, but on this wall over here is just a big wall of cat pictures of stuffed animals that are kitties. Her son brings the cat every other week or so, but she loves to have the girls come in and visit too. She is so excited when they come every time, and then talks and talks about her kitty and when her kitty's coming again, and how she can't wait for the girls coming in. So, now this is one of the activity rooms, and there's actually patients. There's here, there's another couch behind us that you can't see in this picture where there's 2 more patients, and they're all interacting together, and they're talking to each other, and they're talking, to the facility coordinator, and interacting together. So you can see that it obviously really brings out a lot in these patients and gets them moving when they wouldn't otherwise be moving. So it's a very important part of the activity. We continually are expanding or asked to come in new nursing homes. I think we're doing at least 5 or 6 right now. We've already added another one in Douglasville, so we should be up to 7. They just keep warning us. I get calls from other nursing homes. They're also asking questions. So there's so many benefits to this that I think it's important to have the interaction with animals. I think we don't appreciate it while we have the option, and we don't realize that eventually we may not have that option, and how we'll feel when that's something that we can't do just when we want to. That we have to wait on somebody to bring animals in, just so we can even have that connection any longer. So I think we're fine on time. I'm willing to answer any questions that you have, or anything about the cats, their training, anything about animal therapy in general.
How long does it take you to get a cat to where they will accept other people?
It's best to start young. If you really, first off, you need to find a kitten that's very open. So if you go to the shelter and you're thinking about getting a kitten, you want the one that goes up to everybody. And then the next thing to do, of course, is for their safety as well as for the safety of any patients, you want to harness and leash train them. It's just, your cat can be the sweetest cat, but if they're not used to being on a harness and a leash, they can run off, they can jump out of your arms. You need to have that control over the cat for their safety, because you don't want to be walking into the nursing home and it be on, say, 27 and the cat jump out of your arms and run off. That would be horribly nerve-wracking, and you don't want them to startle a patient that may not like the animal, be it a cat or a dog. After that, the next most important thing is to get them used to riding in a car, because you don't think about it, but you're going to be doing a lot of riding. The girls usually have a max tolerance level of about 30 minutes, and they're ready to get out of the car. That's about as much as they do. So it limits, there are going to be limits like that you have to keep in mind. And then you have to know the animal. You have to be aware that sometimes the animal's not feeling well, or they're just in a bad mood. They wake up on the wrong side of the bed just like we do. And you need to know when you need to call and say, hey, it's just not a good day. We're going to have to, so-and-so, Teresa's having a bad day, or Callie's having a bad day. And I can either, or you can, I have 2, so I can always bring one and not the other if it works out like that, which makes it nice. But you don't always have that option. Sometimes you only have, I had Callie for a little while, and sometimes it's just like, no, she ain't doing it today. She's just not into it. So there's several things you have to be aware of when you're doing this. Brent?
Yeah, how long have you been doing this exactly?
Researching pet therapy or doing pet therapy?
Doing pet therapy.
I've been working with Agape for a year. I helped them set up their pet therapy program, the cat section specifically, because they didn't know anybody else that knew how to do what I do with cats. People sell cats short is really a problem. They don't realize that they can learn how to walk on a leash and learn how to behave in public and learn how to ride in the car and like it. People think, they try to shove their cat in the carrier and take it to the vet, and it's this big traumatic experience because you don't do it very often. My cats go out at least every week or 2. So it's different. But I've been researching pet therapy for probably about 5 or 6 years now, and that really prepared me. I've been working with Callie and taking her places since the first day I got her. She sat through at least 3 master's level classes, and she's been back to visit. She's been to guest lecture when I've been brought in to present in classes or lecture, say in like animals and psychology with Scott. The other semester, I brought them in to being meowed at. So, you want to have them prepared. So you can't just jump in. Okay, I got them on the leash. Let's go to the nursing home, because you want to ease them in. You're going to take them to the nursing home. You want to do assisted living first, because it's a little lower key. There's less machines. There's less emergencies. The people are more able to react to the cats, and then go into the nursing homes. Yeah.
Of course, you're going to have to pick a niche and develop it. It's cool that you pick geriatric patients to develop this. But of course, there are other populations where pets are also useful. I'm thinking, I wonder, maybe you can tell us, mental hospitals, children's hospitals.
Actually, pet therapy is really a hugely expanding field. Tanner Hospital is actually starting right now to try and set up a pet therapy program. I'm in touch with them to possibly start using the cats, working with the kids there. They're also interested in my husky. I'm going to work with him and hopefully have him certified soon. There's also education. There's a lot of animals in education now, like for kids learning to read. The kids will read to the animal because it's less stress-inducing than reading to an adult. So the kid will be more willing to read. Also in law, they're starting to allow therapy pets in the courtroom for assault victims, especially children, and they sit behind in the witness box with the patient so they can pet them, so that it helps enable people to face their actual, the person that did that to them, and be able to testify, which is a lot more effective than, say, a written statement or even a video recorded statement. So it helps me get these people convicted and off the streets. And then also in medicine at all levels, going into the hospital with children, adults, and geriatric patients. So it's really a hugely expanding field. I mean, we even do it on campus here. In finals, there'll be the puppies that come in over at the UCC in just, I guess, 2 weeks. Not this week, not this coming week, but the next week they'll have the puppies there. So even in higher education, everybody's starting to realize that this connection is so basic and vital that we need to utilize it to make the best of it for everybody. Thank you.
I feel like such a killjoy.